Have you ever wondered what your stool might be trying to tell you about your health? Brace yourself, your bathroom visits could be revealing more than you think. Stay tuned, because today we're uncovering the top 12 things your stool reveals about your health. You won't want to miss this. Hey everyone, welcome back to our channel, your go-to source for all things health and wellness. If you're new here, don't forget to hit that subscribe button and ring the bell so you never miss an update. And if you find this video helpful, give it a thumbs up and share it with your friends and family. Today, we're diving into a topic that's often overlooked but incredibly important: what your stool can tell you about your health. Yes, you heard that right. Your stool can be a powerful indicator of what's going on inside your body, and understanding it could help you catch potential health issues early on. So let's get started. Before we dive into the specifics, let's talk a bit about why stool is such a good health indicator. Your digestive system is responsible for breaking down food, absorbing nutrients, and expelling waste. The condition of your stool can reflect how well your digestive system is functioning and even hint at issues in other parts of your body. The color, shape, size, and consistency of your stool can provide vital clues. From revealing dietary deficiencies to signaling serious health conditions, your stool can offer valuable insights. But remember, while this information is helpful, it's not a substitute for professional medical advice. Always consult with a healthcare provider if you have concerns. Now, let's get into the 12 things your stool might be trying to tell you. Quick disclaimer: the information provided in this video is for educational purposes only and is not intended to replace professional medical advice. If you notice any concerning changes in your stool, please consult a healthcare provider. Top 12 things your stool reveals about your health. 1. Color changes. 1. Brown. This is the ideal color for your stool and indicates that everything is functioning well in your digestive system. 1. The brown color comes from bile produced in your liver, which helps digest fats. 1. If your stool is consistently brown, it's a sign that your digestive system is breaking down food properly and expelling waste efficiently. 2. Green. Green stool can result from consuming a large amount of green leafy vegetables or foods with green food coloring. 2. However, it can also indicate that food is moving through your intestines too quickly, such as in diarrhea. 2. When bile doesn't have enough time to break down completely, it can leave your stool looking green. 3. Yellow. Yellow, greasy, foul-smelling stool can indicate excess fat, which could be a sign of malabsorption disorders such as celiac disease. 3. If your intestines aren't absorbing nutrients properly, it can cause fat to pass through, leading to yellow stool. 4. Black. Black stool can be alarming as it may indicate bleeding in the upper gastrointestinal tract, such as the stomach or esophagus. 4. This could be due to ulcers, gastritis, or even cancer. 4. However, it can also result from taking certain medications, like iron supplements or bismuth subsalicylate, Pepto-Bismol. 5. Red. Seeing red in your stool can be frightening. 5. It may be due to eating red-colored foods, but it could also indicate bleeding in the lower gastrointestinal tract, such as the rectum or colon. 5. Conditions like hemorrhoids, diverticulitis, or colorectal cancer can cause this. 2. Consistency and shape. 1. Smooth, sausage-like. This is the gold standard for stool consistency and shape. 1. It indicates that your stool has passed through the digestive tract at a healthy pace, allowing your body to absorb nutrients and expel waste efficiently. 2. Lumpy and hard. Hard, lumpy stools can be a sign of constipation. 2. This often results from a lack of fiber in your diet or insufficient water intake. 2. Fiber helps to bulk up stool and retain water, making it easier to pass. 2. Hard stools can also result from prolonged transit time in the colon, where too much water is reabsorbed. 3. Mushy. If your stool is mushy or loose, it might indicate mild diarrhea or an inflammatory condition. 3. Diarrhea can be caused by infections, food intolerances, or digestive disorders like irritable bowel syndrome, IBS. 3. Consistently loose stools can lead to dehydration and should be addressed if persistent. 3. Frequency. 1. Normal stool frequency ranges from 3 times a day to 3 times a week. 1. Less frequent bowel movements can indicate constipation, while more frequent ones can suggest diarrhea or a digestive issue. 1. It's important to recognize your body's normal pattern and be aware of significant changes. 1. Frequent diarrhea can lead to dehydration and nutrient deficiencies, while constipation can cause discomfort and more serious health issues if chronic. 4. Odor. 1. While all stool has an unpleasant smell, an extremely foul odor can be a sign of malabsorption, infections, or gastrointestinal bleeding. 1. Malabsorption occurs when your body cannot absorb nutrients properly, leading to excess fat in the stool and a strong odor. 1. Infections caused by bacteria, viruses, or parasites can also cause your stool to smell particularly bad. 5. Presence of mucus. 1. Mucus in stool is typically normal as your intestines produce it to help stool pass smoothly. 1. However, large amounts of mucus can indicate an inflammatory condition like Crohn's disease or ulcerative colitis. 1. These conditions cause chronic inflammation in the digestive tract, leading to excess mucus production. 6. Floating stool. 1. Floating stool occasionally is normal, but if it happens regularly, it might indicate malabsorption of fats or a high gas content in your stool. 1. Conditions like celiac disease or chronic pancreatitis can cause malabsorption, leading to fatty stools that float. 1. High gas content can result from consuming certain foods that are difficult to digest. 7. Pencil-thin stool. 1. Pencil-thin stool can be a sign of bowel obstruction or colorectal cancer. 1. When there is a narrowing in the colon or rectum, stool can become thin as it passes through the restricted area. 1. This symptom should not be ignored, especially if it persists, as it may require medical investigation. 8. Greasy, oily stool. 1. Greasy, oily stool that is difficult to flush can indicate malabsorption of fats, often due to conditions like pancreatitis, where the pancreas is inflamed and cannot produce enough enzymes to break down fats. 1. Celiac disease can also cause this symptom, as damage to the small intestine impairs fat absorption. 9. Undigested food particles. 1. Seeing undigested food particles in your stool occasionally is usually not a cause for concern. 1. It can happen if you eat foods with high fiber content, like corn or nuts. 1. However, if you regularly see undigested food in your stool, it might indicate that your digestive system is not breaking down food properly, possibly due to a digestive disorder. 10. Pain during bowel movements. 1. Persistent pain during bowel movements can be a sign of hemorrhoids, anal fissures, or other conditions that require medical attention. 1. Hemorrhoids are swollen blood vessels in the rectum or anus that can cause pain, itching, and bleeding. 1. Anal fissures are small tears in the lining of the anus, often due to passing large or hard stools. 11. Blood in stool. 1. Blood in your stool can appear red or black. 1. Red blood is often a sign of bleeding in the lower gastrointestinal tract, such as from hemorrhoids or colorectal cancer. 1. Black, tarry stool indicates bleeding higher up in the digestive tract, such as the stomach or esophagus. 1. Both require immediate medical attention to determine the cause. 12. Changes over time. 1. Persistent changes in stool habits, color, or consistency can signal chronic conditions like irritable bowel syndrome, IBS, or more serious illnesses. 1. IBS is a common disorder that affects the large intestine, causing symptoms like cramping, abdominal pain, bloating, gas, and diarrhea or constipation. 1. Noticing these changes and discussing them with your healthcare provider can help identify and manage underlying health issues. Your stool can tell you a lot about your health, and paying attention to these signs can help you catch potential health issues early. Remember, while it's important to be aware of these signs, always consult with a healthcare provider for any concerns. Thank you for watching. If you found this video helpful, please give it a thumbs up and share it with your loved ones. Don't forget to subscribe to our channel for more health tips and advice. Leave a comment below if you have any questions or topics you'd like us to cover in future videos. Until next time, take care and stay healthy.